Inhale, exhale, breathe in, breathe out. The act of moving air out of and into the lungs to allow for gas exchange with the internal environment. Principally, to flush out carbon dioxide and bring in oxygen is known as breathing, or ventilation. This cycle allows us to survive. As a result, it is regarded as one of the essential activities required by our bodies. In an individual, our breath has patterns that include tidal volume and respiratory rate. Eupnea is our normal and relaxed breathing with respiratory rate of 12 to 20 breaths per minute. Tachypnea is stated as that there is an increased respiratory rate, or your breathing is fast. Hyperpnea means your breathing is deeper and faster than normal. And lastly, Cheyne-Stokes. It is an abnormal pattern of breathing, where a person suddenly increases, then decreases his breathing. It was stated that the COVID-19, our current worldwide disease caused by a virus that culminated in a pandemic, impacts our breathing patterns since it targets the respiratory system. One of the symptoms of COVID-19 is experiencing dyspnea, or the experience of not being able to breathe in enough air. In the normal manner, when a person breathes, oxygen crosses the alveoli into capillaries and is carried to the rest of the body. When SARS-CoV-2 enters the respiratory system, it spreads rapidly. It starts to attack the lungs, which causes dyspnea. Here, the white blood vessels come into the scene. They start to release cytokines or groups of protein molecules to protect your body and fight the invaders. In order to reduce the chance of getting the disease, experts develop vaccines that contains antigens or disease-causing agents that causes the production of antibodies that stays in our body to fight diseases. As a result, this vaccination is one of the possible strategies for ending the epidemic. Vaccines are developed through a series of steps and phases. Our COVID patients are probably having the hardest time. Many of them began to lose hope and accept their fate due to respiratory difficulties. Consider the anguish and difficulty that the aforementioned ailments caused them. Let us merely pray that this pandemic will be over soon, so that other individuals will not have to go through this awful experience.
Take a deep breath, inhale peace, exhale happiness.